Oral submucous fibrosis is a high-risk precancerous condition characterized by chronic progressive scarring of the oral mucosa that is caused by an abnormal collagen production leading to formation of fibrous bands in the connective tissue underlying the mucosa, leading to generalized oral burning sensation, inability to open mouth, and progressive stiffness. Is associated with chronic placement of pan or betel quid in the mouth. Pan is mostly placed in the vestibule by the habitual user for around 16 to 24 hours daily. The disease is seen primarily in young adult betel quid users in Indian subcontinent, Southeast Asia, and China. The patients present with the chief complaint of inability to open mouth, also known as trismus. Mouth opening progressively decreases with severity of disease. An interincisal distance of less than 20 millimeters is considered severe, and in advanced cases the jaw may become inseparable. Another presenting complaint includes a generalized oral burning sensation that is termed stomatopyrosis. The clinical features exhibited by the patient suffering from oral submucous fibrosis seen on oral examination includes a blotchy marble-like pallor of the oral mucosa, vesicles and ulcerations. The tongue may become immobile along with loss of papilla. And then betel chewers mucosa. This is a brown to red discoloration of the mucosa, and this kind of mucosa tends to desquamate. Submucosal fibrous bands are also palpable on the buccal mucosa, soft palate, and labial mucosa of fully developed cases, and leukoplakia of surface mucosa may also be noted as well. Most commonly affected sites include buccal mucosa, retromolar area, and the soft palate. Here are a few of the images that exhibit the clinical features of oral submucous fibrosis on the buccal mucosa and soft palate. Pan or quid consists of a betel leaf that is wrapped around a mixture of areca nuts, slack lime, tobacco, sweeteners and spices. Let's discuss the individual effect of each component. Slack lime releases alkaloids from areca nut to produce a feeling of euphoria. Due to this feeling of euphoria, the habitual chewers keep the quid or pan in mouth for prolonged periods. While areca nuts induce fibrosis because of the various components that are present in the nut. Tobacco might not have a direct impact in the development of submucosal fibrosis, but it causes epithelial alterations like leukoplakia and dysplasia, which may later result in carcinogenesis. The basis of development of oral submucosal fibrosis is a disruption of balance between collagen synthesis and degradation. The alkaloids we talked previously about causing euphoria also stimulate fibroblasts to produce collagen. While the flavonoids inhibit collagenase, which is an enzyme that catalyzes collagen breakdown. Now talking about copper, which is present in areca nut, upregulates lysyl oxidase, which is an enzyme involved in collagen cross-linking. This process renders the collagen fibrils resistant to degradation by the enzyme collagenase. Lastly, the cytokines and growth factors produced by activated inflammatory cells induce fibrosis by inducing fibroblast proliferation, upregulating collagen synthesis, and downregulating collagenase production. Hence, all these components combined disrupt the balance between collagen synthesis and degradation, leading to development of fibrous bands in the connective tissue underlying the mucosa. What's seen microscopically is juxtaepithelial and submucosal deposition of densely collagenized hypovascular connective tissue. Along with this, a chronic inflammatory infiltrate may also be observed microscopically. The epithelial changes include hyperkeratosis and subepithelial vesicles, which are seen in the early lesions. However, older lesions exhibit epithelial atrophy. Here, in a mucosal biopsy, you could observe hyperkeratosis, basilar hyperplasia, submucosal fibrosis, along with chronic inflammatory infiltrate, as discussed previously. Mild cases may be treated with intralesional corticosteroids. However, moderate to severe cases may require surgical splitting or excision of fibrous bands followed by physiotherapy. Various alternative treatments are also currently used for the treatment of oral submucous fibrosis. These include hyperbaric oxygen therapy, which suppresses fibroblast activity, has anti-inflammatory and antioxidant properties. Secondly, the Ayurvedic and natural compound remedies, which includes use of turmeric, honey, aloe vera, curcumin, and lycopenes, which help alleviate the symptoms. Then we have various topical and intralesional proteolytics like collagenase, hyaluronidase, and human placental extracts that may also help with a few of the symptoms. Lastly, the use of various vitamins, minerals, and antioxidants may also provide some help. Dysplasia is reported in 10 to 15% of the cases that have been sent for biopsy, while carcinoma is reported in 6% of the cases. Unlike tobacco pouch keratosis, oral submucous fibrosis does not regress with habit cessation. Still, habit cessation is most important to avoid progression of the disease and development of carcinoma.